Intermittent self-catheterization is a procedure in which a flexible tube, called a catheter, is inserted into the penis all the way up to your bladder to empty urine. It is prescribed when you have trouble urinating on your own. Your providers have explained how to catheterize yourself and how often to do it. This video serves as a reminder of that process. A Coude catheter is a catheter with a curved tip that helps the catheter move through the natural curve of the urethra and into the bladder without difficulty. You may have been sent home with a Coude tip catheter or a straight tip catheter. The Coude catheter has two sides. The larger side is the drainage end of the catheter that the urine comes out of. This side also has a bump called a raised indicator that should always be facing upward when inserting. The smaller side is the Coude catheter tip, which is inserted into the urethra or the opening at the tip of the penis. When inserting the Coude catheter, the curved tip must be facing in an upward direction, and at the same time, the raised indicator will also be facing in the upward position. This is how you know that your catheter is in the right position as you are inserting the catheter all the way to the bladder. It is very important to catheterize yourself even if you don't feel the urge to go. If your bladder is not emptying, it can lead to permanent kidney damage. These are the supplies you will need: soap and warm water for cleansing purposes, a towel, a clean disposable catheter, lubricating gel, and a container or toilet for the urine to drain into. Find a convenient place to catheterize yourself. Some places might be on the toilet, on a chair with a basin, or in the bed with a basin. Choose a place that will give you the best view for placement. Clean the surface area you will be working on and place the supplies on the surface for easy access. Wash your hands with soap and water for 20 seconds. You will need to wash your genitals before the first catheterization of the day and after every bowel movement. Remember to wash your genitals with soap and warm water, pulling back foreskin if uncircumcised before washing. Rinse and dry with a clean towel. Remove catheter from the package using your dominant hand to hold the larger end of the catheter. Do not touch the tip of the catheter or allow the tip of the catheter to touch anywhere. Apply the lubricant gel to 2 to 4 inches of the catheter tip. Place the larger end of the catheter over the toilet or the basin. Use your dominant hand to insert the catheter and the other hand to touch your genitals. Hold the penis at about a 45 to 50 degree angle to your stomach, and the curved tip of the catheter should be facing up while inserting. As you are inserting, observe the raised indicator to ensure that the catheter is in the correct position. Slowly insert the catheter into your urethra. Insert the catheter about 6 to 8 inches or until you see urine flowing. If the catheter does not advance, don't force it. Try to relax and take a deep breath and try again. If it still does not advance, please call your provider. Once you see urine flowing, insert catheter 1 to 2 more inches, then slightly lower your penis. If flow slows down, take a deep breath and bear down. When urine stops flowing, slowly pull the catheter out an inch or two until it flows again. Once urine flow completely stops, slowly remove the catheter and throw it in the garbage. Your catheters are only to be used once, so you must throw them away after each use. Finally, wash your hands with soap and water for 20 seconds. Be patient with yourself if you are just starting to self-catheterize. Catheterize when you are not at your fullest. Have all the supplies laid out before you start. Wash your hands thoroughly before and after. Breathe deeply and keep calm. If catheterizing in a public restroom, take extra precautions to prevent contamination or infection. Wash hands before entering the stall, use wipes to clean surfaces, and use hand sanitizer right before catheterizing. If you have concerns or difficulty using your catheter, call your provider. You may need a different catheter that would be easier for you to use. Call your healthcare provider if any of the following occurs. You are unable to advance a catheter and no urine is seen. You are still feeling bladder pressure even after inserting the catheter. Pain, swelling, redness, warmth, or discharge of pus or blood at the catheter insertion site. New abdominal, pelvic, leg, or back pain. Burning in the urinary tract, nausea, vomiting, and/or unable to eat. Blood clots that look like red or dark brown clumps in urine. Red, not pink, urine for more than 2 days. Large red or brown particles in your urine. A strong, uncomfortable urge to urinate or bladder spasms for more than 2 days. Little or no urine even after drinking fluids.